Hi, I'm Marcus from Hambledon Rehab, and today we are going to be looking at the corrective strategies you can use if you have discovered that you have a cuboid fibula sequencing issue. We're going to start with a drill on the floor, so you'll need somewhere comfortable to lay down. This drill can be used if you're having difficulty with the fibula moving forwards, but also if you're having difficulty with it moving backwards. Doing the drill from the floor means that anybody that has any pelvic floor issues or core stability issues is supported whilst they're carrying out this corrective strategy. Okay, so we're going to demonstrate the movement to begin with. Some people call this shin box. You've seen this before. If you've been into clinic, we've almost certainly done this. And we're going to use this to narrow down exactly where it is that we have these issues. So if we look at this leg driving first, this actually mimics the back leg in our gait assessment that we were doing just now. The foot is in its supination phase. The fibula should be moving backwards. The femur is externally rotating and our hip is going into extension as we're doing this. As we're doing this, we want to do it nice and slowly so that we can see where there are any issues, where our breath changes. So we're looking for aches and pains, and remember this is anywhere in the body, not just where we are working. In terms of breath, we are looking for changes in volume or pace or sound, and that will tell us where it is that we need to work. On the collapsing side, this actually mimics our forward leg in our gait assessment that we were doing just now for the cuboid and fibula. So we can see that our foot is still driving down through the heel. The foot is in pronation. The fibula should be moving forwards. The femur is in internal rotation, and obviously we have hip flexion up here. So I'm actually struggling to come this way on this left leg. It's struggling at the distal portion of the fibula. So we have three techniques that we can use to try and rectify this. One is the direction of ease. So the direction of ease would be this way. So we're going to hang out here. I'm going to stay here for a good couple of seconds. This should feel nice and easy. Shouldn't have any changes in our breathing. Shouldn't feel any aches or pains. And then we're going to come back. And there's a little bit more movement. It feels a little easier coming into that position as we slide from one side to the other. The second technique that we can use, which actually works really well with the direction of ease, is to give it some assistance. We're gently going to help that fibula move forwards. Okay, so there's a little bit of tension just here to help it move into that anterior position as we come through here. So if we combine that with the direction of ease, we're going to hang out here for a little bit. And then as we come through, locate the correct portion of the fibula, and we're just going to ease that anteriorly as we come through and push off with the rear leg. And then go back, reassess. And again, it feels a little easier, but it's still a little stuck. So the last thing that we can use are the finger magnets. And to do this, we need to listen to our body and see where it is that we need to work. We need to feel that within ourselves. And actually, this feels quite simple. So we have one here and one just on the calcaneus. They feel good. So we'll hang out there. Now again, sometimes when you're doing this, this can take a little while. I'm only going to do a short correction because you don't want to sit through 15 minutes of me holding my fingers on my ankle. If it feels like your fingers want to move whilst you're doing this, and you might be able to see my fingers moving very slightly, just go with that. Follow the flow. This is your body helping you work out exactly where you need to place your fingers. Good, that seems to have stopped. So we'll go in the opposite direction to begin with, and then we'll come through here, and that feels lots better. So you've got 3 strategies that you can use to improve your cuboid fibula alignment in the sequencing in a supine position, so when you're laying down on the floor.
So for those of you who struggle to get down on the floor, or where you don't have core or pelvic floor issues which may impact on the assessment and corrective strategies we were just using, or where you're ready to progress, we can use a standing strategy. So our feet need to be parallel on the floor rather than in kind of whatever comfortable position you would normally find yourself. So feet nice and parallel. We're going to take our hips back in that hip hinge position. We're going to take ourselves from side to side, like so. Now as we're doing this, the straight leg mimics the rear leg in gait. So our fibula should be moving posteriorly. And you can see here the external rotation happening at the femur as well. In the bent leg, this mimics the forward leg in gait and the fibula moving anteriorly. So as we're doing this and we're just going through and we're assessing what's going on, or not quite so happy that way still. Okay, so we know we've got an issue on the left. So we're now going to look for aches and pains. Now these can be anywhere in the body, not just in the kind of foot fibula region that we're looking to work. Yeah, it's definitely that way. We're also looking for where it is in our breath that we exhibit a change. So either in the pace or the volume or in the noise that it's making. We're going to use the same 3 corrective strategies. So we can coach the fibula. It feels a little tight up here as well as down the bottom. So I'm just going to check to see how that is moving as we go through. Moves back quite nicely, doesn't want to move forwards. So we can coach that very gently through here. We can also use this with the direction of ease, the same as before. So we take it into that back position. So we're taking the fibula posteriorly in our direction of ease. And then as we come through, we're just going to help that rotate round. Again, we'll have a little look. Not bad, a little bit of clicking going on now. You can probably hear that on the video. So we can use the finger magnets. So, in this occasion, we actually have something in here. Just there, that finger. And at the top of the fibula. So I'm going to do this and I will cut the video for you so that you don't have to sit through all of this. Good, so that seems to be resolved now. So we're going to come back into our standing position. We're going to evaluate what's going on. So we're going to go into the direction of ease first and then come back around through here. You can see that is moving a little easier. There's still some work to do. Okay, so once that's moving well on both sides, no issues, we're going to take this foot, we're going to place it half a foot forward, and then we're going to repeat the drill. Exactly the same. You'd be moving from side to side. You evaluate for any aches, pains, any changes in breath, and you go from there. And again, half a foot, half a foot, half a foot, until it's moving well in all planes as you go through that. I'm not going to demonstrate that because I still have some work to do here and I don't want to aggravate anything. If you found this video useful, please give it a thumbs up. Any questions or queries, please pop them in the comments below and I will get back to you as soon as I can. Don't forget to subscribe to my channel, might be over there. And please feel free to share this content as widely as possible.